Hi everyone, this is Vicky from NP Reasoning, and today I'm going to talk to you about diagnostic frameworks. So, essentially, how to apply diagnostic frameworks to any clinical case that comes in front of you. There is no need to wing presentations when we see patients. We should essentially always be using some form of diagnostic framework to guide us through that presentation. So, again, we're going to learn how to create these diagnostic frameworks for common presentations. It's important to highlight that it's not a one size fits all. So, I'm going to present what types of frameworks you can use. And it's really about you experimenting and figuring out what frameworks work well for you given the current presentation in front of you. So, let's get into it. So, really, how do we create differential diagnoses, right? We're not winging it, we're not pulling things out of thin air. We use our knowledge base about disease and we create these diagnostic frameworks for various clinical presentations. So, the four common frameworks used in medicine are the systems framework, the mechanisms framework, the anatomic framework, and the checklist mnemonic framework. Again, really important to highlight that it's not a one size fits all. It's really up to you to figure out what framework works best in your brain to organize a case in front of you. And I'll go through many case examples of what I mean by this. Now, let's think of the mechanisms framework. This is kind of you asking the question, what mechanisms cause X? So let's start with this example. A 20-year-old female's coming in with fevers on and off for 3 weeks. So, a fairly long history of fevers. What I like to ask myself is, what mechanisms cause fever? So, of course, there's infectious mechanisms, and that bucket can be broken into bodily systems. So it's a framework within a framework, as you can see. So thinking about, respiratory infectious causes, gastrointestinal, genitourinary, neurologic, etc. My next big bucket is what inflammatory or autoimmune mechanisms could be causing this fever, like rheumatologic disease. Third big bucket you wouldn't want to miss is, there could be many malignant causes, right? So you'd want to be asking about unintentional weight loss, drenching night sweats, etc. Thinking about things like lymphoma. And then the other bucket would, common ones could be a medication side effect if they have a history of substance use, withdrawal. Those are things that you'd want to think about. So again, what mechanisms cause fever? I break it into these four big buckets with the various etiologies, and that helps me ask the questions when I see that person, right? Do you have any chills? Do you have a cough? Do you have a headache? Do you have a rash? Do you have swollen joints? Are you having unintentional weight loss, drenching night sweats? Are you withdrawing from any medication? Do you use any substances? Right. So as you can see, when you have a comprehensive, organized framework, you feel more confident going in to assess that patient. And creating these frameworks for yourself take a lot of work, but it is worth it because it'll set you some solid groundwork for going through your career and seeing these presentations. A second example of the mechanisms framework would be a patient presenting with acute low back pain. Very common presentation, really, regardless of where you work. So, what I like to ask myself is, what mechanisms cause back pain? Right? We think of neurologic. Could it be cauda equina? Could it be infectious, an epidural abscess, autoimmune, like sacroiliitis from ankylosing spondylitis? Could it be traumatic fracture? Could it be a malignant, spinal tumor or metastases? And then lastly, musculoskeletal. Could it fall into that, mechanical back pain presentation?